Good day, Sacramento. I'm Dina Kupfer. We are in Natomas this morning, and this is a very unique gym. It is called SCI-FIT, and they really truly do focus on those who have had spinal cord injuries and other items that they just want to make sure are taken care of. And so many of us have a specific reason why we work out, why we go to the gym, why we have our physical activities that we like. This is for people who are going through something and need an outlet. So we have Mike Terrell with us, who is the CEO and co-owner of SCI-FIT. So the acronym SCI is?
Spinal cord injury.
Yes, okay, so it's all in a name. So let's talk about, first of all, just the model of what SCI-FIT is. You have multiple locations actually across the state.
Yes, we have 6 locations.
Yes, okay, so what do you do here?
So we're an activity-based therapy gym. Our main focus is getting people as healthy and as independent as possible. They're gonna come to us with different goals. Our job is just to help them reach their goals the best way we can.
Okay, and so your clients, many of them have injuries, obviously, it's in the name. So we're seeing actually one of your clients get some work done today. What exactly are they doing here?
So over here, Kurt is doing squats. So he's on our total gym and he's working on load bearing.
Okay.
So being on his feet helps with maintaining his bone density, also giving him a better connection to his body. So right now he's trying to locate his legs, trying to feel his legs, currently at this position. So yes.
Okay, so for your clients, I know you said many of them are coming on retainer, sometimes multiple times a week, months, sometimes years on end, right?
Yes, our longest clients have been here for 15 years.
Wow.
This is more of a marathon, not a sprint. This is a lifelong journey.
Yeah.
We are excited to be a part of that journey, right? So we treat everybody like family. So when they're with us, we're trying to make sure we're giving them the best that we can. We want this to be the best part of their day, basically.
And I know so many clients, you have a lot of reasons why people would choose a place like this to be able to get their strength and their physical health back in shape and back to their goals. What are the other types of clients that you see? If somebody's watching and thinking, I need something like this, who exactly benefits from this type of a workout?
I know you already said spinal cord injury, but spinal cord injury, stroke, MS, cerebral palsy, any kind of movement disorder, we basically are here to help. We don't want to turn anybody away. If there's somebody that needs help, we're going to do our best to make sure either we research and figure out how to help them, and if they like to be here and this is the spot for them, then we're going to go for it.
Yeah.
We want people that are dedicated and want to get better, and this is what we're doing.
Yeah, and you have specialists, not necessarily physical therapists, but specialists working with your clients, and so they really do get to know their client, get to know their routine, and they're the ones working with them day in and day out to work on those particular ailments.
Absolutely. Like I said before, this is a family. So when you come in here, we're going to treat you as such, because you know you would do anything for your family, I would do anything for my family, right? That's what we want everybody to come in here and feel that. And that's where we're going to get the most benefit, as well as like physically, but also mentally. That's a big game that people don't realize is a big factor in this, right? So we help that. This creates community. You're not alone.
Yeah.
So.
And giving that independence back is so, so, so important. So we're going to have much more coming up at the 10 o'clock hour, but if you think that this is something that would be beneficial for you, maybe you're watching on behalf of a family member or a loved one, a friend, you can go online. We're going to have all the details linked up to gooddaysacramento.com. They also have a really wonderful Instagram account. That's how I discovered this, through the help of Courtney Dempsey. So if you are interested, we'll make sure we link all those details to gooddaysacramento.com. Mike, thank you so much for your time today.
You're very welcome.
All right. We'll be right back in the 10 o'clock hour with a little bit more, guys. Back over to you.
Looks good, Dina. Thank you so much.
With a professional staff and cutting-edge technology, a physical rehab center is helping people get their independence back.
Okay, let's go back to Dina, live in Sacramento, getting a look around SCI-FIT. Dina, this place is amazing.
It's incredible, and what it stands for is spinal cord injury. So SCI-FIT here in Natomas. There are actually 6 locations, and we've only been here for about 45 minutes or so, and I have seen some incredible machines and also heard some incredible stories. So we have Mike Terrell, who is the CEO and co-owner. Tell me more about what we're watching right now and exactly what John is getting assistance with.
Yes, this is John. He is a L1, L2 spinal cord injury. So right now this machine is called the Excite system. What it's doing is giving functional electrical stimulation to his muscles to help him perform this overground gait training. So right now the pads that you see on the front of his shin there, they're going to go ahead and flex his muscle and help him with lifting his toes up. So it's going to make that ankle flex into dorsiflexion so he can clear the ground. Also on the back, you see him on his calves. Those are helping him push into the ground to propel himself to that next step. So he's using loft strand crutches right now. The neuroexercise specialist, Lauren, behind him, and she's assisting, holding him, helping him with his balance while having the machine tug along. So she's doing a lot. She's amazing right now.
And so what exactly? Yes, he sure is. And I mean, he wouldn't be able to do this without a machine like this.
No. So the machine is definitely helping him be able to assist and pick that leg up.
Wow.
Yes. So he could do it without, but it would be a lot slower and his foot would probably drag. Yeah.
Let's talk about the types of clientele that you have here. Someone like John and some of the other clients we've been able to watch this morning go through the motions of all of their exercises. We have another one here on the bike.
Yes.
It's just incredible to see these folks who have had these injuries. Sometimes they are lifelong injuries, and the goal here is to give them some independence, right?
Absolutely. That's our main goal, is to get them more independent and, again, healthier, right? Kurt over here on the FES bike, which stands for Functional Electrical Stimulation, what it's doing is it's taking him through a cycling motion. So those pads that are on his legs are helping him fire those muscles and do that movement. So it's retraining that nervous system on how it's supposed to move. Also helps with maintaining his bone density and helping with disuse atrophy. So because he's not able to stand up, right? So his muscles tend to get smaller. This will help them get stronger.
And let's talk about the progression that the folks here make. Some of these clients you've had here have been coming for years. Some are brand new, but they get to see the people who have progressed and see those who are making strides. I can imagine not only the physical part of this, but the mental part is huge for some of these clients.
Absolutely. The mental part is one of the biggest things, because that's what's fueling everything else, right? So like you said, them coming in here and seeing people that have been through this for years and learn to adapt to certain things and figure out how to move better, they can give those gems to the people who are just recently injured. So they don't have to go through those hardships, right? And not feel alone.
Yeah. And for anyone watching, if you feel like some of these machines you are interested in learning more about, I mean, it's very unique, the items that you have here. You even have one along the back that works specifically with hands and fingers.
Yes.
I mean, it is cutting edge technology that you have here. Who should reach out? If somebody has a recent injury, a lifelong injury, who would best benefit from a program like this?
Yes, both.
Okay.
Recent and lifelong, right? We're here again to help you on your journey and to reach your goals. Okay. So whoever wants to get better and come out and join a family and get fit and just get active, that's us, right? We like to tell people, we know a lot of people have been told that they can't. We love being a part of telling them that they can and showing them that. So that's a big
It really
thing.
is. It's incredible work. High five to you, my
Yes,
friend.
thank you. I
It's
appreciate
wonderful.
you.
Many locations again across Northern California. So we're going to have all their details. SCI-FIT. You can go online. You can follow them on Instagram and get yourself signed up. Or if you know a loved one, a family member, or a friend who could benefit, certainly spread the word. Share this video with them. And let's tell more people that they can. They sure can. All right, back to you.
Thank you very much, Dina. That was good stuff.